Therapy Chat Podcast, episode 352.
This is the Therapy Chat Podcast with Laura Reagan, LCSWC. The information shared in this podcast is not a substitute for seeking help from a licensed mental health professional. And now, here's your host, Laura Reagan, LCSWC.
This week's episode is sponsored by TherapyNotes, the #1 rated electronic health record system available today. With live telephone support 7 days a week, it's clear why TherapyNotes is rated 4.9 out of 5 stars on Trustpilot and has a 5-star rating on Google. TherapyNotes makes billing, scheduling, note-taking, and telehealth incredibly easy. And now, for all you prescribers out there, TherapyNotes is proudly introducing ePrescribe. Use coupon code CHAT or click the link in the show notes to get 2 free months at therapynotes.com. Are you tired of running to the lobby to see if your next appointment has arrived? Would you like a more discreet, stress-free way for your clients to check in? Take a deep breath. The Receptionist for iPad empowers your practice to create a Zen-like check-in experience. This episode is sponsored by the Receptionist for iPad. It's the highest-rated digital check-in software for therapy offices and behavioral health clinics used by thousands of practitioners across the country. Start a 14-day free trial of the Receptionist for iPad by going to thereceptionist.com/therapychat. And when you do, you'll also get your first month free when you sign up. Hi, welcome back to Therapy Chat. I'm your host, Laura Reagan. And first of all, if you hear a puppy in the background, yeah, I got a puppy. And if you follow me on Instagram at Therapy Chat Pod, you'll be seeing puppy pictures. So apologies for the whining. She's currently downstairs, quietly letting me know she wishes she were upstairs. And if it's bothering you, I'm sorry. Hopefully this won't be a usual thing. You won't hear a lot of the cat today because he's not a huge fan of the new puppy so far. Anyway, that's where we are today. So I'm very glad you're here listening. I have a lot to talk about. First of all, today is apparently World Mental Health Awareness Day. So every day is Mental Health Awareness Day here. And I hope that you are aware of your mental health today and every day. Also, October is both Breast Cancer Awareness Month and Domestic Violence Awareness Month. So in case for you, October is spooky season and you weren't aware of those other things, now you are. I've really been thinking about breast cancer a lot because I have a friend who's currently going through breast cancer treatment. And I've had more of an up-close and personal look than I ever had before of what that process is like. And Domestic Violence Awareness Month is something that I've always known, at least my adult life, because of having my background be in working with survivors of sexual and domestic violence. So when you work in that field, you know April is Sexual Assault Awareness Month and October is Domestic Violence Awareness Month. So with both breast cancer awareness and domestic violence awareness, those issues are traditionally seen as issues affect those identifying as female. And the majority of people who experience those two things, breast cancer and domestic violence, are female or female identifying, but it's not limited only to women. And the reason I'm emphasizing both of those points is because what we're talking about today on the podcast relates to both. We're not talking about domestic violence today, but we are talking about trauma and we are talking about women finding our voices. Because in healthcare, those identifying as female are often dismissed in the medical care system in the United States. And it begins with our socialization in childhood, that we are taught to ignore, dismiss our own inner knowing in order to fit into a likable identity as female. We learn not to trust our own inner knowing and to focus more on external approval, whether that's based on our appearance, how nice we are, how well we take care of others, how outspoken we are, and that harms us. You know, I'm thinking about the women in Iran who are literally risking their lives and their families' lives and safety to protest against laws that say they have to dress a certain way, behave a certain way. And in the United States, more and more laws are being created to control how women show up in their own lives and the decisions that they're allowed to make legally about their own lives and their own bodies. And I'm not going along with that. So I guess the point I want to make is that when we learn to abandon our own knowing, our own thoughts and feelings, our own wants and needs in the service of making other people happy, there's a real toll that it takes. We can get lost in caregiving. We can be unable to identify our own wants and needs. And there's always a price to pay for that. It takes a toll on our mental health, no question. And it can take a toll on our physical health. So my guest today is someone who is refusing to be quiet about the way that the medical system has dismissed and minimized her inner knowing of what she feels, what's happening in her body. My guest is Dr. Christina Hibbert. Dr. Christy Hibbert is the #1 best-selling author of the award-winning memoir, This Is How We Grow, and of 8 Keys to Mental Health Through Exercise, Who Am I Without You, and the forthcoming Mastery of Motherhood. Dr. Hibbert is a clinical psychologist, speaker, social media influencer, and thought leader in the areas of maternal and women's mental health, grief, loss, trauma, self-worth, personal growth, and breast cancer. She's the host of both Mastery of Motherhood podcast and Like a Watered Garden podcast, and creator of her award-winning website and blog, drchristinahibbert.com. Christy is also a breast cancer warrior, overcoming triple-negative breast cancer and the BRCA1 genetic mutation through chemotherapy, cold capping, and 13 surgeries as of the time that we recorded. She was named Most Inspirational Women's Health Professional 2018 and 19 and won Best in Show Blog 2020 for her work as a patient leader in the WeGo Health Awards. A wife and mother of 6, Christina was deeply honored to be named Mother of the Year in Arizona 2018. I would like to be named Mother of the Year, but I don't think that's ever going to happen. I'll ask my kids. Maybe they could say that, at least tell me that once to make me feel good. What we're talking about today is how the breast cancer diagnosis is traumatic. The process of healing from breast cancer can be very traumatic, and how there's a real missing piece in tending to the emotional side of cancer treatment for everyone, and in particular in breast cancer treatment. Christy talks about how the treatment process was challenging, but what happened afterwards, well, I don't know if she would say it was more traumatic or as traumatic, but it's been very traumatic. And she has been a powerful advocate for herself with her treatment providers. I'm sure she has a great team, and she is cancer-free, and she's still fighting health effects of breast cancer and the treatment process. And she's still successfully advocating for herself when doctors tell her that the symptoms that she is experiencing are in her head. Now, I have certainly experienced myself doctors telling me either my symptoms were related to, you need to lose weight. If you lose weight, then your symptoms will go away, or your numbers are fine, so there's nothing wrong, when I know there is something wrong. I've worked with many, many clients who've had that same experience, who've had to fight for tests that doctors didn't want to provide because they didn't think that the symptoms met the criteria. And maybe a lot of this is driven by insurance companies, which I have a major problem with as well. And again, it's not about saying that doctors are bad. It's saying that medical providers need to listen to patients, and patients need to trust ourselves. You know yourself, and you know when something feels wrong in your body. And women, more so, are dismissed, and women of color, more so than white women, are dismissed when they express their symptoms, and often we aren't believed. So if you've had that experience, I want you to know you're not alone. If it feels deeply traumatic, you're right. And Dr. Christina is really trying to raise awareness about the need for patients to trust themselves and for providers to trust patients and listen, that we know what's going on with ourselves. We know ourselves best. And I think that there's a major effect of patriarchy in the idea that, women are hysterical and they blow things out of proportion. It's all in your head. And this patient is, being non-compliant or trying to control the treatment or using Dr. Google. And the idea that, the male-dominated medical system is all-knowing when many studies and many treatments have only been tested on men. So sure, we all have the same biology ultimately as humans, but there are differences in our bodies, and that's real. So how does this tie in with domestic violence? Well, when women are not given the same credibility just because of our female identity, that's oppressive. And that's one of the aspects of domestic violence. It's about a power differential, a power imbalance. Men have power, women have less power. And if you are in a non-binary, gender fluid, trans identity, it's even harder to get people to listen, to take you seriously, to understand your body and to understand your relationship to your body. If you are in a fat body, it's really hard to get doctors to listen beyond telling you to lose weight. It's like, come back when you lose 50 pounds, and then you lose 50 pounds and they're like, well, you're 50 pounds overweight still. So come back when you lose 50 pounds. They don't say come back when, but it's like, well, what can I do? There's nothing you can do except you could lose weight. It's unacceptable. So the weight piece is not really part of what Dr. Christina is talking about today, but it all fits together in the change that's needed in our healthcare system, the change that's needed in the way doctors are trained. I mean, they don't learn to tend to people's emotional needs in treatment. And it doesn't have to be the doctors doing it. It could be a multidisciplinary team where people who have expertise in helping people with emotions are part of the team. So I was definitely inspired by this conversation. I appreciate Christina because she's real about how it feels and what she's going through, and she shares about it to benefit other people, and it really lets people know that they're not alone. So I hope you will enjoy my conversation with Dr. Christina. I was very honored to speak with her, and if what I'm speaking about resonates with you, you should check out her Instagram and Facebook. Also, if you are a therapist who wants to know more about working with survivors of sexual trauma, I have put together a short training. I'm in the process of applying for CEs for this, so it's not yet available on my website. I did lead the training for my Trauma Therapist Network members live last month, and all of the TTN members can access the training for free as part of the membership. But if you are not a member and you are interested in that training, just go sign up for my email list, and there's a link in the show notes. And as soon as it's live on the website, I'll let you know. And if you're a therapist who wants to join Trauma Therapist Network and get the self-care call, case consultation, Q&A, and training every month live with me and recorded for you to watch later if you can't attend live or you just loved it so much you want to watch it again. Registration will be opening later this month, and that link is also in the show notes. You can go ahead and get on the waiting list if you like, and you will have first access. All right, so let's dive right into my conversation with Dr. Christy Hibbert. Hi, welcome back to Therapy Chat. I'm your host, Laura Reagan, and today I'm so pleased and honored to be speaking with Dr. Christina Hibbert. Christy, thanks so much for being my guest on Therapy Chat today.
It is truly an honor, and I'm so glad that we get to do this together.
Me too. And we tried to make it happen before, and I had to cancel, so thank you for your kindness and quickly rescheduling. I've been really looking forward to our conversation because I really have followed your work for a long time, many years, and you were talking and writing a lot about grief based on your experiences. But more recently, you had a life-changing experience that came up. And as you've been sharing about that so generously on your social media, it's really been impactful for me. So I definitely want to talk about that. And let's just start off, though, by you telling our audience a little more about who you are and what you do.
Thank you. And thank you for saying that. I'm a psychologist and I'm a mom of 6 kids. And really, though, I'm a person like anybody else out there who has been through quite a few traumatic experiences in my life and a lot of loss. Starting when my youngest sister died when I was 18. She died of cancer at age 8. And, then going through different mental health challenges as I became a mom, and I had postpartum depression, and that sort of, all these things sort of influenced the things that I started to study and work on as I then became a psychologist and got my degree and started working. And later, some other big things, like my brother-in-law died of melanoma in 2007. And 2 months later, my sister died of an overdose of Tylenol and alcohol that was ruled a suicide. And they had 2 young sons. I was about to give birth to what I thought would be our 4th child and ended up becoming our 6th. We inherited our 2 nephews and went from 3 to 6 children. Boom, just like that. That was a huge trauma for the whole family. In fact, I feel like as a mother that our family was really created out of loss and grief and trauma in a sense. And then some other things over the years. I had another very close friend who dropped her daughter at my house with my daughter and kissed her children, my son's best friends, goodbye, and drove to the Grand Canyon and jumped and became very involved in helping her family through that time. And another close friend who died of cancer just a year before I was then diagnosed with breast cancer myself. And that's what you're referring to. That's been the journey that I've been on the past almost 3 years. Next month, it'll be 3 years that I've been dealing with this, and it's gone on way longer than I thought. I've had all kinds of complications, 13 total surgeries. I did chemotherapy. I did cold capping and was able to save my hair, and ended up with breast implant illness, had to start my breast reconstruction all over again, ended up with a hernia that was so massive. I mean, it was like life-threatening and led to now gastroparesis, a paralyzed stomach and a paralyzed colon. And so my digestion, my body doesn't work the same. And all of that, as you know, and as anybody listening can imagine, left a pile of trauma and grief and loss and identity crisis and you name it. So that's been the journey that I've been on with my family for the past few years. And as you said, very openly sharing and trying to just make sense of it for myself and heal myself, but also share with others so that they too can know what it's like and to know what they can do to heal themselves as well.
Yes. And I said to you before we started recording, and I really want to say it again, that what you're sharing is so beneficial. You know, I think a lot of times people talk about like, I'll share my story to help other people. And sometimes that's kind of like reliving your trauma over and over. And, you know, unfortunately, sometimes re-traumatizing yourself and traumatizing those who are listening as well. But I think that what you're doing is just like teaching as you go. It's such a beautiful way, sharing your own humanity and something that anyone could go through. Any of the things that you have experienced and are experiencing now, any of us may experience in our lives. And just the way, I don't know why, but maybe because you're a psychologist and just who you are as a person, the way you share about it, even though it may be painful to listen to a given experience that you're going through for the listener, it's so informative and helpful and naming something that so many people go through that we don't usually hear about.
Yeah. Well, I really appreciate that. I think that's the best compliment I could receive. Being able to share has been helpful for me in my healing process. I'm an open book, literally. My first book is literally a memoir of the time after my sister and brother-in-law died and how we got through that. So I kind of live my life that way. But I feel like this has been something while I've been so sick and haven't been able to see clients and speak and write and do the things that I normally would do. This has felt like something that I could do to be of service and to connect me with others. And there's just so many, as you know, as any listener knows, so many out there who just feel like they don't have a voice and nobody understands. And so I thought, well, if I can just sort of share the step by step, and some days it's me, as you've seen me saying, I'm so angry. I hate that I got cancer and what it's done to me. Or another day it's me like crying and just like, I can't, last week I had a cancer scare again, I'm just freaked out and sharing what that's like and how scary it is. And I guess to me, I feel like the best thing I can do is just show up as me and share the real and the raw and let people see my weakness and my strength because we all have it. And that's the only way that we get through. I feel like if we can be open and honest with ourselves and then find that help that we need. And that's what I've been trying to do for myself.
Yes. And I've seen all of those posts. I mean, I watch everyone because I'm like, oh, wow, she's going through this now. Or, oh, good, this is happening, and it's so real. And like I said before, it's like what we don't normally hear. And I think, I've seen people go through cancer treatment who wanted to, well, for one, there's the fight,
Oh, yes.
message.
Mm-hmm.
And you do want to get that cancer out of there, and so, and I've heard like, don't focus on anything but the possibility that, cure, only, like, don't allow anything but that. And that doesn't feel right from a therapy perspective, that we know that like you're feeling other things. And if you're just focusing only on positive, then you may be suppressing other feelings that need to be felt, which I think you may agree, sort of can contribute to ill health as well. That if we can't express and trauma's stuck in there, we know that connects with ill health too, or disease.
Absolutely. It's that perpetuating cycle then.
Mm-hmm.
And that is, I'm so glad you brought this up, because there is this, to use the word that's floating around a lot, the toxic positivity
Mm-hmm.
side of cancer, especially, is I think people are just extra scared of it. People, when they hear that you're diagnosed, they come out of the woodwork. I felt so incredibly supported when I was going through chemotherapy and when I was having my double mastectomy and my first surgeries. I felt more supported than any other time in my life by people that didn't even know me. And,
Mm-hmm.
People were sending me gifts, all these things. But there's another thing happening that you don't realize when you're going through it, which is you're being traumatized by all those pieces too. Just the diagnosis is traumatic to yourself and to your family too, to my children, to my husband, to my parents. And I did immediately go and get myself a psychologist to go see. And I knew that I would need that therapy. Most people don't do that because they don't realize.
Mm-hmm.
So I was trying to deal with the emotions as I was going through these treatments. And as you know, it was just kind of like everything kept going wrong.
Mm-hmm.
I lost one implant, then I lost the other one, and then, I get infections, staph infections. I'm back in the hospital. I'm out of the hospital. And so you're just trying to, you are kind of trying to like stay positive. And I feel like I look back on that time during the first part, like the bulk of my treatment. And I think, why was I so positive? I really was. I was trying to be the warrior.
Mm-hmm.
And I really took on that name because I felt like I feel like I'm a warrior, like I'm in battle after battle after battle.
Mm-hmm.
And if you look at my camera roll from chemotherapy, there is not a single picture where I'm not smiling in a cape, with a crown. I wore a Wonder Woman costume one time, for my birthday, I had a birthday sign on. And yet chemo was the worst. It was miserable. And cold capping, it's painful. It's like a brain freeze for 9 hours. And you're constantly changing these things out to try to save your hair. And then in between, it's a lot of work and effort. And I looked at one point, once you're told you're done with treatment, which you're not done, first of all, let me just say, but your doctors say you're done, see ya. And that's kind of that, except for your yearly checkup with your oncologist, maybe. You realize, oh my goodness, like there is this pile of grief and trauma. I felt like I was on a conveyor belt and just going through whatever they told me to do for my treatment. And that the treatment itself, it wasn't even the cancer, it was the treatment itself that was just causing all these other problems and these long-term problems. And then at the end, you're dumped in the middle of nowhere and everybody's disappeared. There's nobody there to guide you or tell you, okay, now you're going to have a really tough emotional journey because you haven't been able to deal with it. Because I realized like I couldn't deal with it in that deep way. I was doing what I could.
Surviving.
I was surviving. I was in survival mode. And I thought I was processing what I felt at the time, but I also was trying to stay positive and be that warrior because that's what everybody wanted. And then when you're done, it's crickets. Like everybody disappears. Nobody's there for the aftermath of the war, which is the hardest part. I think most women I've talked to, and I do a free online breast cancer support group now every month. And everybody says, the after part is the hardest because I don't know what to do with these emotions. And I feel like I don't know who I am. I feel lost. My relationships are strained. My family's stressed. I'm anxious. I'm scared. I'm going to get a recurrence. And there's nobody there guiding us through. So it is a really challenging and difficult experience. And I would liken that to any kind of physical health challenge, but most physical and mental health challenges, don't have that rally like you see with cancer and that expectation of you're the cancer warrior, you're the fighter, you got this. And I'm telling you, I hate now when people say you got this, because it's just like, it's so more complicated than that I got this. Like I do. And I believe in God and like, he's got me, but there's so much more to it. It's not that simple at all. And you feel very lonely. And that's especially the mental health side of things. I feel like that's the same thing. They're just crickets. Nobody wants to be there for the aftermath of the physical health war. Nobody wants to be there for the mental health war. They're just not there. And then you feel alone.
Yeah. And I mean, what you said, like first of all, I've heard that about you got this, like people don't want to hear that, but also like when you said afterwards is the worst part, it's like, well, immediately I'm like, oh, post-traumatic. It's just like in a war, you get through the war. And then when the war is over and you're safe, then the impact of it begins to hit you. And that's what causes the trauma symptoms that we see. So, but then I'm thinking too, like how culturally, and this is why I appreciate what you're doing so much and that you're sharing it here too, that people don't know. They're like, oh, you're done. Great. It's over. Thank goodness it's over. We never have to think about that anymore. And you're like, wait a minute. I think it's just started.
Yes. So true. When, I literally walked out so my plastic surgeon was the one that told me I was done after my hernia surgery and after all my reconstruction. And I literally walked out of his office that day and I stood there. I was by myself. It was during COVID. Of course, COVID made everything that much harder being by yourself. And I just was like, is he right? Am I done? Like, is this what done is? I don't even know. Nobody told me, nobody prepared me. And I thought, okay, I did. I went and made a video like, I'm done with treatment. Oh my goodness. And then I start realizing, okay, wait, I have major depression going on here. I've got like major grief. Okay. I think I've definitely been traumatized. That you're right. It's like after the war, and think of the destruction that happens after a war. You don't just go back and resume your life. And I thought, okay, now I can finally emerge as the butterfly. I'm ready. I'm done with treatment now. And I realized, no, now I can go build the chrysalis and go into it and then melt away and go through all that process, which is what I've been doing the past year and a half. And I feel like I'm still, just barely beginning to get to that place where I'm actually healing and not really doing all that deep work. Not to mention my body started getting sick and all the after effect consequences came. And so, yeah, that is definitely a big hard part of it, is that, it is the post-traumatic experience. And the problem is that most of the women I am connected with, they don't even realize that they've been traumatized.
Right.
So you just know you're feeling anxious and depressed and whatever, but they're not receiving help. They don't know where to turn. They don't know what to do. And that's one thing that I feel that I have been able to help with, is to give a name to what they're feeling. And then other people going through similar types of things, they can understand that too, because it's not just cancer, obviously. Anything that's major and traumatic, like chronic illness or even mental health challenges as well.
Right. Yes. Thank you. And it's, and one thing that's coming to my mind when you're talking about that line between being in treatment and being done with treatment, and like what it feels like in the amount of support transplants, people who have transplants, that whatever was so sick, that organ that was so sick, they were constantly in the hospital and everyone's concerned and, can they get that transplant? If they could get that transplant, and then they get the transplant, and then they now have a life of being immunocompromised and, avoiding organ rejection and dealing with side effects of all these medications that they have to take so they won't lose the body won't reject the organ. And it's that same thing. It's like you see it as, oh, you're cured. It's okay now. And then I think that's like partly culturally, again, we don't like a complicated story. We like a clear, like, okay, good. When's this going to be over? Okay, good. It's over. Thank goodness. We never have to think about that again. But that's not really how it works.
It does not work like that. And I didn't know this until I was going through it. I thought the same as everybody else. So I do understand why people think that, and why it feels like crickets, like nobody's around and, nobody cares anymore when you're done, because you're not really done. And that's the thing is, I mean, you followed my journey. I mean, it doesn't feel to me like I've been done, and in fact, somebody was asking me about like trying to tell me how long it'll take to heal. And they said, take however long you're in treatment and double it. And that's how long healing takes. And then I said, but what is treatment? It's not just the chemotherapy and the surgeries. I mean, this whole past year, the gastroparesis, and now I'm trying, I have to take a medication to go to the bathroom to be able to poop. My body is totally different. I couldn't sit up a year ago. I couldn't even lift my head or roll over. And so I've had to completely rehaul everything and now learn how to live with chronic illness and, change diet, change everything. So it is a misnomer to think. I love your example of a transplant, that a lot of these illnesses, they just become a chronic illness. And I feel like breast cancer is a chronic illness because you're always scared. You're always checking, like me last week, checking to see, I found a lump. Oh my gosh, I have to have a biopsy. You're always getting scans. You're always going back. And there's many different kinds of cancer and breast cancer in particular. And, some are scarier than others. The one that I have is very aggressive, and you won't ever be able to say you're cured. There isn't a remission. You're not in remission. It's not called that. They call it no evidence of disease. That right now I have no evidence that I have cancer. I also carry the BRCA1 genetic mutation, and that puts me at risk for all kinds of cancers. So I'm getting, scans for pancreatic cancer and melanoma and I had a hysterectomy to get rid of ovarian cancer. And it's a lifelong diagnosis, essentially. So it's something that'll always affect me and always impact me, especially now with my chronic illness. And also, all the scars in your body's been completely rearranged. And so, yeah, that it's a complicated process that I think most people don't understand. And that's one thing that I've been trying to educate people on big time is, I just posted something saying, I'm cancer free, but I was told I was cancer free a week after I was diagnosed almost 3 years ago. And yet look at everything I've had to go through since I was told I was cancer free, because they cut it out by doing a double mastectomy. I still had to do chemo. I still had to do all these other things that cause all these problems. And I'm not free of cancer. It's always going to impact me. And kind of like mental illness too. Like you might be able to be in a good place with your depression, but if something hard happens in your life or something comes up, it's going to come back. It's likely to come back. So same thing. And I do struggle with mental health issues as well. I just like to be open and honest about that too, because so many of us do. And I think we need to talk way more about these things. I feel like maybe my sister and my friend would be around if they felt like they could openly talk about what they were feeling and going through and not feel so ashamed.
Running a group private practice has been a challenging and rewarding experience, and one thing that has made it so much easier is TherapyNotes. TherapyNotes makes billing, scheduling, note-taking, and telehealth incredibly easy. If you're coming from another EHR, like I did, TherapyNotes makes the transition incredibly easy, importing your demographic data free of charge so you can get going right away. My team has found TherapyNotes very easy to learn. It's intuitive. The customer support is second to none. And that's one of the things that has kept me a TherapyNotes customer for several years now. Anytime I've needed to contact TherapyNotes for help with an issue I couldn't figure out on my own, I've been able to get through to someone and resolve the issue within 15 minutes, 99% of the time. Find out what more than 100,000 mental health professionals already know. Try TherapyNotes for 2 months, absolutely free. Just click on the link in the show notes or enter the promo code CHAT at therapynotes.com. Therapists, has this ever happened to you? You're sitting with a client in the thick of a therapy session, fully focused on the important work that's happening between you and the client. Suddenly, 30 minutes into the session, from down the hall you hear the door to your office suite open. You and your current client were the only people in the suite, but now someone has come in. You're distracted from your current client as your anxiety shoots through the roof. Is it your new client who's scheduled to meet with you in 30 minutes? But your current session has 20 more minutes to go and you don't want to interrupt this client's process to go check on who's there. Are they wandering through the suite looking for a receptionist? Is it a delivery person here to drop off a package that needs a signature? Are they about to come knocking on the therapy room door? Is it your neighbor from across the hall dropping off a piece of your mail that was left at their address? You hear the door close. Did they leave? This has happened to me so many times over the years. As I anxiously anticipated this session with the new client, I would worry they were feeling anxious or abandoned because they weren't greeted when they got to the office. Now you don't have to worry, and your clients can relax too, knowing that you have a discreet, stress-free way for them to check in when they arrive for their appointment. The Receptionist for iPad is a simple, inexpensive way to allow your clients to discreetly check in, to notify providers of a patient's arrival, and to ensure your front lobby is stress-free. The software sends an immediate notification to the therapist when a client checks in and can even ask if any patient information has changed since their last visit. Start a 14-day free trial of the Receptionist for iPad by going to thereceptionist.com/therapychat. And when you do, you'll also get your first month free when you sign up. Yeah, well, thank you for saying that. And I do want to say, I meant to say this when you were talking before, but I just didn't want to interrupt. But I am so sorry for all of those losses that you've experienced. It's so much loss in one young life at the time when those things happened. You weren't even that old. And
thank you. I
that's
appreciate
a lot.
it.
Yeah. And regarding like mental illness and mental health, I feel like my perspective is those traumas create mental health symptoms, and that's what we live with our whole life. But I feel like the impact of trauma can heal if it can end, if it could stop. But when you're continually experiencing trauma like this, and I think that's kind of one of the experiences that isn't necessarily named about chronic illness, is that you're living in a body that's not functioning the way it did before you got sick. And that's a continual process of, adjusting and adapting to that change. That there's a lot of loss in that, all the loss of the way things used to be and what you could do.
Yes, absolutely. I think that's a big part of this. Who am I now? I do a lot of work around self-worth because I feel like it's the big thing that we all need to work on and be able to feel in ourselves. And that's really hard. I mean, I had been through this kind of loss of identity with the losses and the deaths in my life before. But then when you add in your body actually not, it's one thing like when I was dealing with depression or anxiety or those kinds of things, but this body thing where literally my body looks different, it feels different, it works differently, all of that. And you're right. And it is such an adjustment. And then it's so easy to get triggered because every little thing, like last week, having to get a biopsy in the place where I was when I was diagnosed with breast cancer with the same doctor in the same room, every time I went to physical therapy in the hospital where I had my first emergency surgery to remove one of my breasts, one of my implants, all of that is just retriggering. And then because because of what I do for my work and because I believe in doing your work, I've been doing my trauma work as well the past many months. And of course that's triggering as well. That brings up a lot of things and it brings up, I was telling you earlier, I mean, I feel like it's like a string, when you have a new trauma, it just tugs on all the others and they kind of come with it. And it's almost like they move into a new position. And even the ones that you've dealt with in some way in the past, because I did go to therapy and work through the deaths and the losses, but boy, this breast cancer trauma, it's not only it's complex, it's that complex PTSD is really what I've been dealing with. It's brought up all the developmental trauma that happened in my childhood. And then also all these traumatic events in my life, they've all come up with it. It's all linked. And so for anybody listening, just to know that you can feel like you can have done the work and really done what you needed to do. And you've healed at that place in time, but then something else can happen, like as happened here. And it just tugs it all with it into this new place in your life. And you have to deal with it in almost a whole different way or in a deeper way, perhaps. And that's what I've been having to do these past many months, is deal with all of it again.
Yeah. Unfortunately, that I agree. It's like, I think of it as like that place that holds those past experiences is where the new one goes. And, it sort of just blows the whole thing open and then it's all mixed up. And it's not like it's like clear. Oh, this is clearly about this. And this is clearly, it's just a mess of chaos and feeling out of control and scared and lost and, sometimes maybe hopeless. And,
that's why I call it a pile of trauma.
Yeah.
That's what I feel like breast cancer has been. I came out the other end with a body that wasn't working, being sick still, telling me I was done, but I'm not cured, but I'm better, but I'm not better. And then this pile of trauma, I have 6 children. So when I used to do laundry, the pile of laundry was enormous. And it's sort of like, felt like I had to start sifting out, kind of like I used to do, like whose stuff goes where. And that's really hard to do when you have so many traumatic events. And that's what illness is. It is just trauma after trauma after trauma on top of trauma on top of trauma. And that's why it's so complex. to heal from and to deal with it. Cause I didn't even know where to begin. And this is my specialty area. I've worked in loss and grief and trauma for like 20 years of my 20-year career. But boy, I didn't know where to begin because there was just so much to it. Where do you start?
Right. And also not to mention that trauma makes you feel, confused and disoriented and it's chaotic and, so it's like, ugh, it's hard to even, and that's again, why I appreciate what you're doing, because the fact that you have the training and education and experience to contextualize what you're going through and explain it in a way that's understandable is just such a valuable, it is a way of being of service. And it really is, because I think I have so many thoughts, but there's three points that are standing out. One is, I feel like I wonder what you think about this, but I feel like the emphasis on so two of the points go together. The medical process of cancer treatment, for example, but other types of disease treatment as well, focuses on making the illness go away, making the disease go away. And so it's whether you cut it out or you kill it with chemo or immunotherapy or, whatever it is, get it out of there. And then that's it. You're over and done. And so one branch of that is your experience where you're cured, but you're not, you don't feel worse than you did before. And, making sense of what does this mean? But the other side of it is sometimes people are like in the fight, stay positive. And then the doctors go, there's nothing else we can do. And you're like, what? And so I feel like in a way, it unintentionally creates a situation where people don't get a chance to come to acceptance with mortality. So, and then they're not ready and maybe there's nothing that can be done. And it's very quick and they're not ready and their family and it's not prepared because everybody's just been like, no, we'll find a cure, Yeah. And that can create a very complicated trauma and grief experience, both for the patient and then the people they love,
Yes. I really appreciate you saying that. I think it's so true that's why I'm such a proponent of feel what you feel.
Yeah.
And talk about it in safe places with safe people, because then you are prepared for whatever happens and you're not stuck in that toxic positivity place and you're not in denial. And it's also, I was just talking about this on another show about, how my children have dealt with my cancer, and especially, my one son who is the older of my nephews. And my biggest fear has been that I would die and leave them again. They've lost their mother and then two best friends' mothers, and he told me, a couple months into it, that the reason why he wasn't coming around, he doesn't live at home anymore, was because he just couldn't deal with it, and I understood that. And then at the same time, I had one of my daughters was 16 and she was just angry at me because she was going through depression and suicidal thinking and panic attacks. And I was going through chemo and I was super sick and I couldn't be there for her. And, I realized later she was angry at the cancer, but I'm just so glad that I knew and that I had some skill and training in the ways of communicating about it, talking about it, and being open with my kids and with myself, trying to always get in tune with what I'm feeling, what's really going on. And you said that word mortality, and that's what scares people about that cancer diagnosis. That's why people rally. That's why they cheer. And that's why they want it to be done, because we do not want to face our own mortality. And I've dealt with it when my close family members died, but I've never dealt with it in the sense of I have an illness that really, if I did nothing right now, I would die for sure. And so that's a huge thing that the person going through the treatment is going through. And if we don't deal with it while we're going through it, you're right. I mean, whether we are cured or whether we are, going to be afraid of it the rest of our lives, kind of like I feel, or whether it ends up being stage 4 and there isn't a cure, we're going to all be better off, and your family's going to get better off if we keep talking. And it's okay to talk. And that's why I started this support group, because there's just not a lot of resources for people going through this. And the medical community, I just feel, needs to do so much better. I mean, imagine if your mental and emotional journey through cancer was just part of your treatment.
Right.
What if they just talked to us about it and they made it part of the treatment? And I shared earlier that, one of my surgeons is starting to do treatment for PTSD. She's retired and she's going to start doing the ketamine treatment. And I've been doing that myself to work through the PTSD ketamine therapy. And, that she said the same thing. I can cut out the cancer, but I can't cure the patient. I can't cure the trauma. And we need more help with that. We need more understanding. We need more resources and safe places for people to be able to do that, because often we can't turn to our families because they're having their own experience with our mortality too. And the other part is, while we're going through treatment, everybody around us is dealing with how they feel about it, but we're just in that survival mode. So that's another reason why you get to the end and you feel like everybody else is done with you. Well, they've been dealing with it all along and we haven't yet. But I encourage anybody listening, and any therapists to encourage their clients to do the trauma work when they're ready, and to help them acknowledge that this is what's happened. And no wonder you feel this way, because you've been through a lot.
Yeah. And I mean, I feel like there's something you're saying that's like just speaking about the unspeakable fears and unspeakable pain. And I call it unspeakable, but it's not. There's nothing that we can't stand to hear from each other. But, when your son said, I can't deal with it, I have to stay away, he's still saying, I'm in so much pain to think that you're going through this and to know that this is happening. And it reminds me of these other things. Even that connects you because you're acknowledging, instead of pretending it's not what it is, that it's hurts. We're all sad. It sucks. We're miserable about this because we love you and we don't want you to be going through this,
Yes. And
so
I love you and I don't want you to go through this. Yeah. And then we come together.
Expression of love. Yeah.
Absolutely. It helps our relationships heal and not just our bodies,
Yeah. And really the change that you're talking about with bringing the emotional experience into the treatment process would not be a huge change. You could just have, therapy as part of the treatment, like you would do with chemotherapy,
That's what I think. That this is where I feel like I have a mission moving forward as I heal more. I just feel like it would be simple to add that in. And how much better would that experience be if it were normalized and talked about? And if you knew you had somewhere to turn, instead of most of the women that come to my support group, and they come from around the world, they come because they have nowhere. And some of them have never talked to another breast cancer survivor. They have no support system. No one's ever told them about trauma or what PTSD is like, or that they can even get help. They haven't had that. And it just breaks my heart, because it would be so simple. And I know there are so many professionals out there that would love to help these women if they could just find the right people, so we got work to do. Yeah.
Well, you are really, really making a big difference in that. And, going back to the beginning of our conversation, you were talking about postpartum depression. And as you said that, I remembered that's where I first learned about you. Mm-hmm. And then, grief became a bigger part of what you were talking about. And I was like, oh, this is very interesting. I'm learning a lot here. And then, just from what you shared, like it wasn't a training or anything, but you taught me so much. And it's because it's from the experience and not just the intellect,
Yeah. Thank you for that. I mean, I really appreciate that. I was sharing this with you earlier, but I call it the Doctor of Life degree. And I think so many of us earn that Doctor of Life degree. I wrote about that in my book, This Is How We Grow, as I was going through that experience after my sister died. It's all those experiences. And if we can use them and share them and talk about them, I don't think other people look at me as weak because I talk about the fact that I'm struggling with PTSD, or that I've had all these health problems, or I've had depression. I just think it connects me with people, and they feel understood, and they feel like then they can speak up, and we sort of start this cycle. So that Doctor of Life part of me is really important to me. And then when I can combine that with my Doctor of Psychology degree, I think we can get some real good information to help people. So that's kind of what I try to do.
Well, thank you for what you're doing. And before we stop for now, is there anything else you want to share? Is there anything you want people to hear or know from what you have to offer? No pressure. But I just didn't want to miss a chance for you to tell something else that you wanted to say.
My message is kind of always the same, just, that none of us escapes life without going through these hard things, and none of us escapes life alive either. So
yep.
Dealing with our mortality, dealing with our bodies changing, even aging, dealing with mental health challenges, acknowledging our weaknesses and our strengths. I always tell, I'm a big proponent. I have a whole model of how to build self-worth that I teach, because I feel like that's such a huge underlying issue. But I feel like the more we talk about these things, the more we do feel our true worth, and we kind of step into who we really are. And we also just have such a potential to do good. So anybody listening, I'm not telling you, you have to go like I do and tell everybody your whole story, but when you have a safe place, when you feel like you are prompted to do so, speak up and say something. I feel like this is the only way we're going to end the stigma of mental health. This is the only way we're going to find understanding for cancer and other chronic illness. And this is the way that we heal. This is how we grow, I guess.
This is how we grow.
So that's what I would say.
Well, that's beautiful. And so speaking of that, and that is the title of your first book, where can people find that book and, your self-worth model if you share it, and anything else that you're doing? Where do you want people to go to find you?
You can always go to my website, drchristinahibbert.com. I also have a free mini course starting off the whole self-worth journey. If you want to get started with that, you can do that. My books are all linked up there, but you can find them on Amazon or anywhere else. And then, of course, I'm very active, as you said, on Instagram and Facebook, and recently on TikTok, which my kids are not happy about, but I'm not dancing, though. I'm not dancing, just sharing wisdom, trying to. So
I'm sure that it will help, because I can't tell you how many people come to therapy and say, I was seeing this thing on TikTok the other day and it really made me realize something about myself. And I'm like, you would dismiss the old way, you would dismiss that, but it's like, well, what was it? And it turns out a lot of times it's something valuable.
There's some good stuff out there. I'm trying to contribute to it. So yes,
well,
connect with me. I love connecting with anybody. So, and if there's any way I can help or serve anybody, just let me know.
I'm so grateful for what you're doing and who you are and what you shared here. So thank you so much for coming on to Therapy Chat today. It was really a pleasure to talk with you.
Oh, such a pleasure to be here with you. I just love you. I told you I wish you were my therapist, but I'm glad. I think it's even better that you're my friend. So, and thanks for all you do too.
Thank you to TherapyNotes for sponsoring this week's episode. I do love TherapyNotes. It's such an asset to my business and makes my job as a practice owner and a therapist much easier. Try it today with no strings attached and see why everyone is switching to TherapyNotes, now featuring ePrescribe. Use coupon code CHAT or click the link in the show notes to get 2 free months at therapynotes.com. Thank you to The Receptionist for iPad for sponsoring this week's episode. The Receptionist for iPad is the highest rated digital check-in software for therapy offices and behavioral health clinics used by thousands of practitioners across the country. The Receptionist for iPad is a simple, inexpensive way to allow your clients to discreetly check in, to notify providers of a patient's arrival, and to ensure your front lobby is stress-free. Start a 14-day free trial of The Receptionist for iPad by going to thereceptionist.com/therapychat, and when you do, you'll also get your first month free when you sign up.
Thank you for listening to Therapy Chat with your host, Laura Reagan, LCSWC. For more information, please visit therapychatpodcast.com.